Today, members of the House Health Committee heard from two former bone marrow transplant patients about how the procedure saved their lives and why there needs to be a bone marrow transplant center here.
If I was to go to the mainland for a bone marrow transplant, I wouldn't have been able to afford it. So I think that it's of vital importance that we have a bone marrow transplant center in this state.
15 to 20 bone marrow transplants were done in Hawaii each year at Hawaii Medical Center until HMC closed in December. Dr. William Louie told lawmakers the need for bone marrow transplants has grown and that a center is desperately needed in Hawaii. House Bill 1952 appropriates $500,000 in matching funds for Hawaii Pacific Health to set up a pediatric bone marrow transplant center at Kapi'olani Medical Center. It passed out of committee today, but the issue now is, where do adults needing bone marrow transplants go?
The key thing about bone marrow transplantation with cancer is that when you have a cancer such as leukemia, time is of the essence. You got to move quickly or that window of opportunity closes very quickly.
The mainland is the only alternative, and insurance doesn't cover airfare or lodging, and you often have to stay there for 3 months.
I am lucky to live in Hawaii and to have a transplant here in Hawaii. I would not be able to pay for my transplant if I had to go in the mainland.
Now, Dr. Louie tells us they are trying to find an organization or a hospital to take over an adult bone marrow transplant program. And House Health Chair Ryan Yamani says if they find someone before the end of this legislative session, they'll make sure they're included in the bill.